With any form of cancer, early detection is so important. It was through early detection that our guest on this episode was able to get in front of lung cancer. Not an easy thing to do. As a result, Andrew McPherson of Woodbury, Minnesota, is with us today, with us as a survivor. So now it's time to hear his story. And Andrew, welcome to the Cancer Interviews podcast.
Thank you, Bruce, for having me. I appreciate it.
First thing we want to do is find out more about you. You do have a life exclusive of cancer. So if you would, tell us a bit about where you're from, what you do for work, and what you do for fun.
Sure. I am from Woodbury, Minnesota. As you mentioned, I grew up on the east side of the Twin Cities and have lived here my whole life. I am married with two beautiful children. I have a 7-year-old and a 3-month-old son that we welcomed this summer. I currently work for a lung cancer diagnostics company based out of Boulder, Colorado, and I lead our sales team in what we call the mountain region. So I do a lot of travel for work around the western half of the United States. When I'm not working, which doesn't seem like to be very much time anymore, I do a lot of volunteer and advocacy work within the lung cancer space. I sit on the boards of the Masonic Cancer Center at the University of Minnesota and A Breath of Hope Lung Foundation. And I like to spend time with my family, and I do like to play a lot of golf.
Now, there had to be a juncture for you as someone diagnosed with cancer, a juncture that all of us who have been diagnosed with cancer remember, unfortunately, and that was the time in which you transitioned from your life being physically normal to something being abnormal, something wrong. What was that for you, and how did it manifest itself?
God, I could almost remember the exact date, and it was probably pretty close to where we currently sit here in September, but it was in 2015. I specifically remember that I was at a healthcare conference here in Minnesota, I think. And we had just finished setting up our booth for the morning. And I went to the restroom and I started to develop just a little cough. And the cough actually produced some phlegm. And when I went to spit it up, there was a lot of blood in it. And I remember thinking that was really strange. But at the time I was only 27 years old. So as a pretty naive and maybe a little ignorant 27-year-old, I didn't think much of it. But I did happen to mention to somebody I was with at the conference that happened. And she, being a former ICU nurse, said, "You need to go to the emergency room right now." And so that was really what kind of kicked off the chain of events that led to my diagnosis.
And if you would tell us a bit more about the chain of events from that point in time when you went in to get checked out and when you were diagnosed. What happened between those 2 points?
Sure. So as I mentioned, this was September of 2015. I went to the University of Minnesota and went to the ER that day. And they ran some blood tests and x-rays. And ultimately what had happened was, at the end of the day, they said, "Please follow up with your primary care physician." And, over the years now of having gone through this and working so closely with the lung cancer community, I see this so often now, is that generally I think the dynamic when a patient is referred to their primary care physician is one of, it's not that serious. To be honest, I go to my primary care physician to get a flu shot. I go, when I think I need a strep test. And those things to me are not all that serious. I personally would have, that's kind of the last resort. If I get sick and end up having to go to the doctor, that I've either exhausted every option I have, or multiple people in my life have probably told me, "Dude, just go to the doctor." So I think that can be an interesting dynamic with patients, is when they find something or something happens and they refer them back to primary care or a family physician, they don't think it's as serious as it might be. And I often think if someone had referred me at that point to a specialist, I might have been much more apt to go in and follow up. So once they did this, long story short, I did not follow up with my primary care physician. I'm sure something was coming up, and then I think I actually was taking my dad on a golf trip, and so I didn't end up following up. Everything kind of cleared itself up. We didn't have any problems, but over the course of the next 14 months, I would continue periodically to cough up blood for, usually a couple of hours at a time. And then once every 2 or 3 months, I was getting pneumonia a lot. In a couple of cases, I actually ended up getting it on both sides. And so again, I would go in either to urgent care or whatever, periodically, and they would just say, follow up with your primary care physician. And so I didn't deem it as anything more serious than just what it was. I had pneumonia and I didn't do anything about it. And then in November of 2016, my daughter was born. And as I guess luck would have it, the morning after that she was born, a friend came to visit me who was a resident at the local hospital here at the University of Minnesota. And again, I think about this often, how lucky it was that the timing of all this worked out this way. But that morning, I happened to have a cough and it produced some blood. And my friend was in the room and saw it. And he was like, what's that all about? So I explained to him what had been going on. And he was like, and you haven't done anything about this? Like, that's really serious. And I was like, no, I haven't. And I remember to this day, he said, dude, you have, it's pretty moronic that you haven't done anything about it up to this point. But the fact that now you have a child one room over, it's bigger than you now, right? Getting sick and all those things are you have to do something about that. And so he really encouraged me to go in and actually go see my family practice physician or my primary care doc. And then when I did, she obviously saw what was going on and referred me to a specialist. And I went and saw a pulmonologist at the University of Minnesota. At the time, I was working in an adjacent medical device field. So I knew the entire team in the pulmonology group. I had actually had lunch with them the same day that I had my first consultation. And they recommended that I would go in and get a bronchoscopy. And again, this is something that not a lot of patients get to experience, and I was maybe in a different position. But when I went to go and schedule that, the scheduler said, well, we can get you in 3 weeks. And my response was, well, that's not soon enough. So I went back to the physicians that I had lunch with that day and just asked, like, hey, here's what's going on with me. Can any of you get me in sooner than 3 weeks? And luckily, one of them said, like, yes, I have time. If you show up tomorrow morning, which would have been the next day, I can get you in for a procedure. And so, this was now like mid to late November 2016. I had to have a few different procedures because, as I mentioned, there was a lot of vascularity going through my lung nodule, and so which is why it was bleeding a lot. It was hard for them to get good visualization of what they were biopsying. And then eventually, when they were able to kind of determine at least that this was something that should be removed, I went and met with a thoracic surgeon. And the thoracic surgeon said, regardless of whether or not this is cancer, it has to come out. Here's how we plan on doing it. And so at the beginning of January in 2017, I had a left upper sleeve lobectomy via thoracotomy. So they cut a big incision from kind of my rib cage up to the kind of middle of my back. And then they went in and spread my ribs, and they were able to take the upper portion of my left lung out, and then they reconnected the airway to the lower portion of my left lung. And then it was only then that they were able to get full pathology on what was going on with my lung nodule. And we found out it was a stage 2A adenosquamous carcinoma. And that would have been in February of 2017. So from September of 2015 to February of 2017, I had cancer just laying dormant in my lung and really didn't do anything about it.
Were you surprised then to get your diagnosis? Because it sounded like you knew more about lung cancer than the average non-healthcare professional. So you knew something, you knew more than most people. So were you surprised to be diagnosed at that young age? What would you would have been what, 27?
I was 28 when I got diagnosed, and then 29 when it was removed. So, or I guess 29 for both. So yeah, I was very young. It was a huge surprise to me. I mean, I've generally not been an overthinker, so there never really was a time until, they told me like, hey, we need to have surgery. This could potentially be lung cancer, that I thought that lung cancer was something that was possible for me. I never smoked. I lived a pretty healthy lifestyle. And again, I was really, really young. So it just never really occurred that could be something that could happen to me at such a young age. And the other half of the coin is, like you mentioned, that I had been close with a lot of these physicians. I had been kind of in this world, so to speak. And so I think that afforded me some, maybe advantages over the average lung cancer patient, in that I knew all the doctors. I felt comfortable with them doing my procedures. I could understand the language that they spoke when they used some, more of the scientific and anatomical verbiage. And so a lot of it I felt really comfortable with. But one of the things that I talk about a lot, if I do speaking engagements with A Breath of Hope, or to a lot of our newer crop of sales consultants at the company that I work for, is because lung cancer often goes undetected until late, there's such a great amount of time that can occur in each patient's journey, from when they first cough blood or first have a sore neck, or some of the symptoms that come along with having something going on in your lungs, to when it's actually removed and they're treated. I mean, one of the biggest things we work on in this world is trying to cut down that time. And the longer that time goes, the longer each patient has to, not only have some of those intrusive thoughts, but to also, I hate to use the word bombarded, but to also be bombarded by friends, family, relatives, everyone and their brother about what's going on. And, are you getting chemo? Are you getting radiation? Are you getting surgery? Like, I had people look up my surgeon when I told them who was doing it, and they were like, I don't see a whole lot of reviews for Dr. Rao. I don't know if she's going to be that great. Maybe you should go get a second opinion. And so for me, like, I never thought about a lot of those things because I felt so comfortable with the whole experience. But when people bring some of that stuff to your attention, inevitably it makes you think like, am I doing the right thing? And, I'd lay up at night sometimes and be like, am I not taking this even seriously enough? Like, anyone I think who's ever been diagnosed with cancer, regardless of stage, probably at some point thinks, am I going to die? And I mean, that's a real conversation that I think we all have with ourselves. And, for me, it was like, my daughter is a month old. Am I going to see her grow up? How serious is this? And so, while I fully respect that, I was maybe experiencing this journey a little bit different than others, it was all new to me. And there were a lot of points where, I just kept wondering, like, not so much why me, but like, how did this happen to me?
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment, or review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon. That way you'll be notified the next time we post an interview. And if you or a loved one are facing a cancer journey, please click on the link in the description and show notes below to get our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. Now, let's get back to when you first got cancer, Andrew, and now you're dealing with the treatment and the regimen of that. When you look back, what was the toughest part of it?
I mean, any time you do a surgery in the thoracic cavity, there are a lot of nerves, and so it is very painful. And I specifically remember a few weeks prior to my surgery in January of 2017, I was meeting with a thoracic surgeon for work. And I had mentioned to him that I was going to be out of work for a little while because I'm going through this and I have to have surgery on my lung. And I won't use the exact wordage that he said, but it was basically like, good luck. And I was like, oh, thank you. And he just said, I'm not going to sugarcoat it. It's going to be very painful. And it was for the first 2 or 3 days after surgery. I was in a severe amount of pain. But the nurses and staff that I had at the University of Minnesota were fantastic. And eventually we were able to come up with a, cocktail of appropriate medications and IV drips and things like that to make me feel better for longer. But the first few days were really agonizing. And so, I think one of the tips and tricks that a friend of mine that had actually also gone through lung cancer before me had mentioned was, I do think a lot of people go in and they think to themselves, like, I'm going to be taking a lot of medication. And, if you have to go through chemo, there's a lot of toxicity associated with that. And so they want to try to limit that amount and tough it out. And I would recommend, anyone in my situation, especially that goes through like a surgery, is take the medications, because you're able to do so much more when you feel better. And by getting, like, I was walking around my floor and they had me doing physical therapy every day. And I was able to get through that and improve so much faster when I felt better and I wasn't feeling all that pain, that, it set me up to get out of the hospital and be a little more self-sufficient when I was out. But I was in the hospital for almost 12 days.
You had mentioned chemo, but I'm not sure, and I just want to clear this up. Was that part of your treatment regimen, or were you just referring to other people undergoing chemo?
Yep. No, I was lucky enough not to have to get any adjuvant therapy or neoadjuvant therapy along with my surgery. My surgeon did a great job, and she felt like that she got everything. The margins on the surgery were great, so we did not feel the need to do any type of chemotherapy or additional radiation, which was wonderful. So I was pretty lucky in that regard.
Now let's talk about a more pleasant aspect of this, and that is when things started trending in a good direction. Was there a point in which you felt, Andrew, that you were starting to turn the corner, that you were getting the upper hand on cancer?
Yeah. I mean, as I mentioned, it was early January of 2017 when this all went down. I was in the hospital for almost 12 days and then was able to go home. And when I went home, I was bedridden for a while. They sent me home with, it's called a JP drain. I think it's a Jackson Pratt is what that stands for, but it was a drain that went in through my side, and they ran a tube kind of up to the kind of the base of like where my neck is a little bit. And that was used just to drain some of the fluid out of my thoracic cavity. And as long as that drain was in, I think I had it for like another maybe 2 to 2.5 weeks into the middle of February of 2017. As long as that drain was in, I felt pretty crappy. I was pretty much laid up in bed. I remember we had bought like a one of those sleep number beds that can raise and lower, because that would be how I would get in and out of bed. But until early February, I did not get out of bed very often. And I specifically remember the day I finally begged, and may have even cheated a little bit. You have to have a certain number of days where the fluid was below a level in order to be able to go and get that drain out. And I think one day when people weren't looking, I dumped a little bit out to try to get to that 3-day in a row threshold. And I remember going back to the University of Minnesota, and they removed it, and it was almost immediate that I felt like I could kind of start living again. And so I think within that week, early February, I actually booked a trip for myself, and I traveled from Minnesota to Chapel Hill, North Carolina to go watch a basketball game. And it was about at that time that I started to feel closer to myself. And then, I really started getting into a little, things that maybe required a little bit more physicality, and not so much lifting weights, but like I was trying to stretch or go and get a lot of movement. And I think I had originally planned a 3-month medical leave from work. And I was able to go back just over a month early. I was excited to get back to work. So yeah, it was really about that point when my last drain came out that I started to feel back to normal. And within the month, I was able to go back to work. And really, since that point, have lived as normal of a life as I think you could, having gone through something like that. I have half of my left lung. I still breathe. If I'm walking through the airport trying to talk on the telephone, I breathe a little bit heavier. I don't love going upstairs, but I still do all of the things that I was able to do before. I try to run 3 or 4 days a week. So I live a pretty normal life now.
Our guest is Andrew McPherson of Woodbury, Minnesota. He's a survivor of lung cancer, and part of that survival story is early detection. Andrew, I think in large part you've answered this question indirectly, but I want to ask you to get, so I can get sort of a direct answer to this. But early on in the interview, you mentioned your airway being reattached. If pre-diagnosis you could quantify your airway as being 100%, what is it like now?
I'm at this point, because your lung is a muscle, I have probably been able to get almost back to the same capacity. Maybe I'm at somewhere between 90 and 95% right now. Again, I get winded sooner than other people. If we were out for a jog together, I would probably get a little more winded. My heart rate would probably increase a little bit faster than most, but it does not really affect my endurance or anything like that. So I can do the same things. I have to work a smidge amount harder in order to do that now.
And you can do all the walking that is involved in playing 18 holes, yes?
Yes, I can. I took a trip with some of my good friends a few weeks ago, and we walked 18 holes a day for 4 days. So
now I want to talk about an organization that you referenced at the very beginning of our interview, because I would like for people, especially those who have been diagnosed with lung cancer, to hear a bit more about it. And that is A Breath of Hope. And it is in, I think, Wayzata, Minnesota.
Wayzata.
Wayzata is part of the Twin Cities region. If you would tell viewers and listeners about A Breath of Hope, what it does, and how it can help others.
Sure. A Breath of Hope Lung Foundation was founded in Minnesota by several survivors and caregivers of those that had lung cancer. Pardon me for not knowing the exact dates, but I would say it was somewhere in roughly 13 to 15 years ago. It is now one of the larger lung cancer only foundations that we have in the United States. We have an executive board comprised of folks in the science community, local physicians, other advocates and former caregivers, survivors. We really kind of base the work that we do on three pillars. One is patient programming and support. We do a lot of work with the local community here in Minnesota, and it is important for us. And I think you could say part of our mission to make Minnesota one of the premier and best places to get lung cancer. We want people in our community to be taken care of when they're diagnosed with lung cancer. So our patient programming is something that we really focus on. Our advocacy is something that is one of our three pillars. To be quite honest, and I'm sure you've had other guests on that have talked about this, but lung cancer certainly has a stigma around it when it comes to those that are diagnosed, in which a lot of people think you did it to yourself. And if you look at statistics now, it's about to the point where 1 out of every 5 patients who are diagnosed with lung cancer have never smoked. So there is a large population of people who are being diagnosed with lung cancer who didn't do it to themselves. Lung cancer is the #1 killer out of every cancer in the world, and particularly in the United States. And more often than not, patients are catching it too late. The overall survival rate of lung cancer right now across all stages is about 23%, which is completely unacceptable when you think and look at some of the overall survival rates of other cancers. I think breast cancer is somewhere in the high 80s to low 90% survival rate across all stages. And so to me, that's a public health issue. If you have something that is as deadly as it is, we don't often catch it until it's its most deadly. And most people think that you end up doing it to yourself. So a lot of people don't really support causes that involve lung cancer. That's kind of created the perfect storm that we're experiencing today. So we go out into our communities and advocate for better screening guidelines. We advocate in communities like the Native American community and the African American community, where lung cancer is a little bit more prevalent, and generally they don't have access to the same type of treatments. And then the last pillar is our research, and we're able to give out pretty sizable research grants every single year to generally young researchers in lung cancer who are doing really groundbreaking and amazing things. And we have several oncologists that are on our executive board, and one of them tells a story fairly often of 15 years ago when he was treating lung cancer, and that was kind of his specialty. He called it the most hopeless job you could ever have, because there was really nothing that we could do other than give a surgery or chemotherapy to a patient. 15 years later, again, as I mentioned, are we where we would like to be? No, but the advancements that we've made, not only in treating lung cancer, but diagnosing it and diagnosing it sooner, we've made a lot, like leaps and bounds. And so I'm really excited being in this now community to see where we end up 10 years from now. I do see at some point in our lifetime really being able to turn the tide on lung cancer. And a lot of that will come through treatment, but I think even more so it's going to come through, as you mentioned, early detection.
And that's very exciting to think about, not only where you are today, but where the entire battle against lung cancer could be 10 years from now. Now, I want to wrap up, Andrew, but before we do, there are people who can benefit from what A Breath of Hope does,
Sure.
Even if they don't live in and around the Twin Cities. If they live in a more remote part of Minnesota or anywhere else around the country, there's lots of good information on the A Breath of Hope website. So if somebody wants to go to that and get some timely information that can help in their cancer journey, where would they go?
I would have to look that up. I believe it would just be a breath of hope .org. I can confirm that. But the other great thing that A Breath of Hope has done, and this is for those that are somewhere along that journey of detection or diagnosis of lung cancer, is we created and built out a website called youandlungcancer.com. And that is a site that we've now seen global interest from. I think we've had patients and people from over 120 countries in the world visit. And what You and Lung Cancer does is it explains in quite honestly a lot of lay terms, what you're going through at the time. So you have a lung nodule. What does that mean? Your doctor wants to take you for a biopsy. What does that entail? You've been diagnosed with lung cancer. What does the surgery look like? What does chemotherapy look like? What are all these immunotherapy drugs that are now coming to market? What are these targeted therapy drugs that are now being researched and coming to market? And so we walk patients through each of those scenarios in short, very easy to understand videos. And I've uniquely enough, I've had people that I work with at my organization have sent me these videos for like training purposes for new sales consultants at our company, and said, like, I found this video, it's really, really helpful. And then I go back and say, yeah, that's actually A Breath of Hope that created that video. So that's one place that patients can go, is youandlungcancer.com. It's a great resource for anybody with questions, whether you're a patient, family, a caregiver. It's really, really helpful.
All right. Excellent, Andrew. Thanks so much. We really appreciate your story, and especially where lung cancer is concerned. A story of early detection is an uplifting story for anybody who's been diagnosed with this, and it lets them know that lung cancer can be beaten and that one can survive lung cancer. So, Andrew McPherson, thanks so much for being with us on Cancer Interviews.
Thanks very much for having me, Bruce. I appreciate it. And thanks for doing this for the community at large. It's really helpful.
Thank you so much. And we want to remind you, as we do anytime when we conclude one of our episodes, if you or a loved one are on a cancer journey, you are not alone. There are people like Andrew out there. There are organizations like A Breath of Hope, the A Breath of Hope Lung Foundation, that can do plenty to aid your cancer journey as you continue your fight against cancer. So until next time, we'll see you on down the road.